Now that the patient has agreed to schedule treatment, how do you discuss finance options with them? Remember, you are there to help the patient solve the problem of how to pay so that they can start their treatment. If you approach this task with the goal of helping the patient rather than selling the patient, the process will go much more smoothly. Here is an example of a financial conversation. Let's take a look at this problem you are having here on your x-ray.
I have a feeling this is going to be out of my budget. What is it going to cost?
I totally understand your concern. We are going to go over costs in detail in just a moment. In fact, we have a number of financial options to help you on this. For the moment, let's first look at what you need and make sure that I've explained this clearly, okay?
Sure, okay, but I will need to know if I can afford this.
Absolutely. We are very experienced with this concern and will certainly work with you on this.
Okay, that sounds good.
Excellent. So let me show you what we've found on your x-rays. Do not discuss finances prematurely. The patient must first see and recognize the need and benefit of the treatment to understand its value. Show them their x-rays or other evidence of their dental issues before talking about cost. Even if the situation is dire, when confronted with how to fund their treatment, patients will not always explore all of the possibilities. It is your job to help patients look at all available ways to fund their treatment. You must work with the patients, offering suggestions and helping them to find the appropriate financing option. If the patient does not have dental insurance or insurance does not fully cover their treatment, then you must help the patient find a way to cover the cost. There are many different ways for patients to pay for treatment, such as cash, credit cards, care credit or similar healthcare financing, the patient's personal credit line, a home equity credit line, a life insurance loan or loan from retirement account, a private loan from a bank, a loan from family or friends. Most likely, one or a combination of options will cover the cost of their treatments. Here is an example conversation where a combination of options is probable.
Gee, this is a lot more money than I thought it would be. I'm not sure how I can pay for this.
I completely understand. We have many ways to help you fund this treatment. I'm going to go through each of these with you so we can help you work this out. I'll ask you some questions, as well as look at some different ways to fund your treatment. Is that okay with you?
Sure, that's fine.
How do you normally handle expenses of this type or amount?
Well, it depends on the amount. I would like to pay for it, but I don't think I have the cash.
I see. It looks like insurance will cover $2,000, so the total you will need is $10,000. How much of that do you think you could pay in cash?
Let's see, I can probably pay about 1/3, 3,500.
That's great. Let's take a look at how to handle the balance. We can take Visa, MasterCard, American Express, or Discover to pay the balance. Maybe one of your cards has cash back or other bonus points that can be of benefit to you. How do you feel about that?
Well, yes, I can put the rest on my Discover card. I do get cash back points when I use it, so that would be valuable. Could I put it on this card and use my cash to help pay it off when I get the bill?
Sure, that's not a problem. I'll take the payment now and we'll get you all set on the schedule so you can get this issue handled as soon as possible. This is what a successful conversation looks like. Did you notice the proactive approach in offering suggestions and guiding the patient towards a solution? Financial problems can often be easily solved by offering finance plans. Here is an example conversation where financing treatment is explored.
I really don't have the available credit on my credit cards to cover this.
I understand. Let's have you go on the computer here and fill out the information for care credit. This is better than a credit card because you pay no interest for 12 months or whatever term offered by the lender your office uses.
Oh, okay. How long will it take to find out?
We will know within minutes, and if approved, we will get you scheduled immediately.
That sounds great.
That was another successful conversation. Many practices have financing programs. Use them if you can. Now, sometimes your patient is savvy and frugal with their finances and understand more complex options. Here is an example of how to offer them different options.
I really don't use credit cards that often. I keep an eye on my credit score, so I prefer not to keep large balances on them.
I completely understand. We actually had a patient recently who borrowed the funds from her life insurance policy. It was essentially a loan she gave herself at a very low interest rate.
That is an interesting option, but I don't have a life insurance policy.
Okay, here is another option. One of our patients paid for his treatment by accessing funds available from his retirement account. He checked with his accountant and was able to quickly access the funds and begin the treatment. It worked out very well.
I could do that, but I don't like to touch my retirement account.
Okay, how about this? Sometimes patients prefer to use a personal line of credit or equity line of credit. This can be a simple way to fund your treatment and get you started quickly. What are your thoughts about this?
Aha! I like that option. I didn't know we could do that. Thanks for letting me know. Let's get scheduled, please.
Now that conversation was a little more difficult, but because all options were explored, a successful arrangement was made. All of the examples demonstrate how a treatment coordinator should consult with a patient. You are there to advocate and support them by helping them get the treatment they need. You must be familiar with a variety of financial resources and be able to comfortably discuss these with the patient.